Ask the Expert is sponsored by Intermountain Healthcare.
Welcome back. The number of people with diabetes is growing at a rapid pace. And Mary is live at Utah Valley Regional Medical Center right now with our Ask the Expert segment. Mary, what have you got for us?
Oh, we have so much to learn about this, Ron. It is an epidemic. We have Dr. Doug Jones here with Utah Valley Diabetes Management Clinic. You have a whole clinic to help people with diabetes. It's a growing problem.
It's a really growing problem, you're right. There are about 29 million people in the United States that have it, and many of them don't even know that they have diabetes. That's one of the biggest problems.
Most of them don't know, right? And all you need is a simple screening.
Yeah, it's easy to screen for, and so if people check in with their doctor, they can have a blood sugar done or another test called a hemoglobin A1C that can often be done in a doctor's office, and then they can find out quickly whether they have diabetes or not.
And why is it so important that they find out?
Well, diabetes is a big problem not only for them, but for the country. $1 in $10 of our health care is spent on diabetes. And of course for them, they want to prevent the complications that you get from diabetes, things like heart attacks and strokes, problems with their kidneys or their eyes. And if we catch it early, they can prevent many of those things.
And how important is it to get some exercise in?
You know, exercise is really big for it. If you could do two things to help yourself to not get diabetes, it would be to eat better and to be more physically active. And that exercise can be something like a formal program or just getting up and moving more. You know, walking, riding a bike, swimming, any of those things are great exercise.
Okay, and the importance of knowing. I think some people don't want to know because they don't want to have to eat a special diet. They don't want to have to follow rules.
Well, that's true. Sometimes people are a little bit afraid of that and they're not quite sure what it's going to mean when they're diagnosed with diabetes. But it's so good for them to be healthier, and they will feel better if they do. And so it really is important to find out.
Okay, Doctor, thanks so much for being here and helping so many people. A lot of Utahns have diabetes and don't even know it. And if you have any questions about you, someone you know, give them a call. We have experts standing by to take your call and answer your questions free of charge, healthcare for free, by calling the number on your screen, 801-357-2900. Or this time around, we're also on Twitter. They'll take your Twitter questions. Just use the hashtag KUTV, ask the expert, ask the question, and they'll answer you right there on Twitter as well. Ron?
Okay, make it as easy as possible.